Hi, Dr. Grigsby. Nice to see you again.
Nice to see you.
And, thanks you for attending our users conference.
We're delighted to be here.
How many times have you been?
Actually, this is the third year for most of my staff. This is my second year. And we actually brought two of our staff last year, and we liked it so much that we brought 5 this year.
That's awesome. Thank you.
Yeah. I thought, we need more of our staff to come this year to help us disseminate the knowledge that we use here.
So how long have you had MaximEyes?
We've had, I think since it was November of 2009 is when we first got MaximEyes.
So you've seen a lot of changes and transitions.
Yes.
So,
and I have to actually compliment your organization, because and that's one reason we came back again this year, is we had some changes that we would like to see in the system. And one of the problems of things that we had dealt with in the past is you saw changes and you wanted to incorporate those in, but it's very difficult to get those in. And it was nice to see, and it was not immediate, but within the next few months we started seeing some of those changes that we had suggested that were incorporated into the system. We think helped it work a lot better.
Well, we appreciate that, and that's the whole purpose of having this meeting, is that people that come here learn, but we also learn from them, and then we try to put them into our software so that next year when you come, we hear things like this, saying, oh yeah, you listened to me. And
I think that's the failure of a lot of programs, is that they get the input, but they either don't do anything about it or don't know how to do anything about it. So
what was the software? What software were you on before MaximEyes?
We were actually on several different systems. Once upon a time, I was a CompuLink user.
I see.
And then we used a system which one of the guys that I practiced with helped design, and it was a DOS-based system called VizRun. And they just kept promising that was going to get better and going to get better, and it didn't. So at that point, we started looking for new software.
Having used different systems, what is it about MaximEyes that sort of
brought us there?
Yeah.
What brought us there was actually we started out with the universe of everything out there.
Yeah.
And then we had really narrowed it down to 3. One was a similar system to MaximEyes, and it was a widely used system, but they seemed to have no interest in really selling it to us, which we found to be a little bit surprising. And our thought process was, if they're not going to help us now when we're trying to purchase something, how bad is the service going to be when we actually have their program? And we looked at another who was very interested in talking with us to help to develop a system, but their system just really had too far to go. It was, we would have had to basically help them put the system together, and that was just not a priority for us at the time.
So how has MaximEyes helped you in the last 3 years as we've transitioned from,
Well, obviously one way it's helped us as far as, meaningful use, and it made it easy to work our way through that process. But it's also helped us organize our data in a fashion.
So what would you say to our audience that are looking at buying software? Why should they pick MaximEyes?
I think there's several things you have to look at. I think one is, what are you getting? How developed is the system? Because it's easy to start and get the basics down of an electronic medical system, but it doesn't always work well together. It takes a lot of time to really refine software to where it really helps you in everyday practice to get there. And I think you have to look at somebody who has a track record to do that. The other thing is, you're going to have problems.
Right.
No matter what you do, you're going to have some problems somewhere in that process. And you have to make sure that you're working with someone who can give you the support you need to work your way through those problems.
All right. Well, thank you so much. Thank you for speaking to us, and thank you for all your support.
All right. Thanks.
Thank you.